Hi there. This is Mark Edelman, speech-language pathologist, and welcome to the teaching of talking. Yeah, I had something very interesting happen yesterday, and this video is going to be about cussing and aphasia. Now, this is a rather taboo subject, cussing, but almost everybody I know does it. They don't always fess up to it. They don't always admit it. But for some reason, in our language, that we have specific words that we use when we get angry or, just in certain emotional situations. Sometimes we'll use words that may not be socially acceptable when we're out and about, or they may be socially acceptable, whatever it is, but in some cultures they're taboo, and in others they aren't, and so that's that. But the reason why I'm talking about cussing and aphasia, or apraxia especially, is that there's a concept in apraxia and aphasia therapy, and that is that the more you've said a word, the more that you have used a particular word in your vocabulary, there's an interesting phenomena that word becomes somewhat easier to say for those who have apraxia. And apraxia is difficulty moving your tongue and your lips and your tongue and your throat to make the speech sounds. And quite often people with apraxia, if you have them say words, they'll have significant difficulty with it. They don't imitate well. They don't mimic well. And mimicking and imitating well is something that affects the prognosis. So if you have a person with apraxia or aphasia and they can imitate fairly well, then their prognosis for improvement of speech is usually pretty good. However, remember what I said in the beginning of this video, that the more you say a particular word, even for those with apraxia, the easier it is for them to say it. So I've been working with one gentleman, and we have a lot of fun in our therapy. We just do. And he's learning how to talk again, and he's got profound apraxia. And we're teaching him how to make the speech sounds with his lips. We're teaching him how to make the speech sounds with his lips and his teeth. We're teaching him how to make speech sounds with the tongue. And he's doing really, really well. Well, the other day we worked on a word that was very, very similar to a cuss word. And so his wife said, well, Mark, he used to say a cuss word that was very similar to this word. And I kind of knew what the cuss word was. And so I said, do you want him to be able to say it? And she said, well, he always said it. If he had trouble with somebody, or if there was something that went wrong, or those words would come out of his mouth like butter. They'd come right out. So anyway, we tried one cuss word, and man, in about 30 seconds, he was able to say that word perfectly. And then there's another cuss word that he used to always say, and he said that one perfectly. And so, speech therapists don't usually work on cuss words. I mean, it's just not socially acceptable. if I was working in a hospital or a private clinic or something, I might even get fired for something like that. But here's the thing. If you're working with apraxia or if you're working with aphasia, you have to work on functional language. Now, what's functional language? I'll tell you what it isn't. Functional language isn't working on the word hairbrush when a guy's bald, and it's not working on toothbrush when he has no teeth. But anyway, where was I going with all this? Yeah, functional language. So, in my mind, what I want to find when I work with somebody is I want to find the vocabulary that person used a lot, because chances are, if they repeated it a bunch of times all throughout their lifetime, then it's quite often a lot easier to help them say those words if they have apraxia or aphasia, because they've been learned so well and they're so embedded in the mind. So we don't spend any time really working on cuss words, but what we find is that people with apraxia, there aren't that many of them. And it's usually their idea. So I'll go along with that. I'll go along with that because it's fun, it's taboo, and it helps people regain the confidence that they can say the words they've always said before. And when this gentleman was able to say those words, man, he was just happier than a clam. I mean, he realized that he is going to talk again. He realized that. Because these were words that he liked to use. He always used them. And now he's starting to use them again. Now, what does that do? That starts to build a person's speaking confidence. And, we don't, in our therapy, we do what most therapists don't do. And that is that we don't confront people for words. Because if you confront people and try to get them to say words when they're not ready to say words, well, they just feel belittled, and they feel like it's never going to happen. But what we do is we find the words that they like to say, we teach them how to say it, and then we have the caregiver, if there's one available, stimulating those words throughout the day. And that's really the trick. And one of the secret sauces to speech recovery for those with aphasia and apraxia. So this is Mark Ittleman, speech language pathologist. I hope you liked this little video. If you did, please give us a thumbs up. If you haven't subscribed to our channel, please do so. And we look forward to helping you. Beneath the video are lots of links, how you can contact me, how you can join the class that I teach on Tuesday and Thursdays for those with apraxia and aphasia. We also have individual mentoring, and there's a link for that. And there's a link for our books and our independent study video courses. So if you're a member of the 80-20, because it works with caregivers too, and that is that there's some caregivers, maybe 2 out of 10, who are dead set on helping their loved ones speak better and will do just about anything to help their loved ones talk. And so if you're an 80-20 person, then take advantage of the material that we have down below the video, and you'll find that you'll get back onto the street or the road to better talking. This is Mark Idelman. Don't forget the thumbs up and the links below the video, and we'll see you on the other side. Bye-bye now, and have a great day, a great week, a great month, a great year, and a great lifetime. Bye-bye now.